What if I told you that the world's deadliest diseases didn't just claim millions of lives, but shape the course of human history? In this video, we'll uncover the top 10 deadliest diseases that forever changed civilizations, from ancient plagues to modern pandemics. If you stick around, you'll learn about the one disease that almost wiped out an entire continent, and it might not be the one you expect. Don't miss out on understanding how these diseases altered the world and what we can learn from them today. Throughout history, pandemics and epidemics have wreaked havoc on human populations. But beyond the staggering death tolls, many of these diseases have also influenced the rise and fall of empires, spurred technological advancements, and shaped modern medicine. In this video, we'll be diving into the top 10 deadliest diseases in history. By understanding these illnesses and their far-reaching consequences, we can appreciate how they have impacted our world and what lessons they offer for the future. Number 1. The Black Death, also known as the bubonic plague. The Black Death, which swept across Europe, Asia, and North Africa in the mid-14th century, is perhaps the most infamous pandemic in history. It's estimated that between 75 and 200 million people died, which equated to about 30 to 60% of Europe's population at the time. The bubonic plague, caused by the bacterium Yersinia pestis, was spread primarily through fleas that infested rats, although it's thought that human transmission also played a significant role. The immediate impact was nothing short of catastrophic. Whole villages were wiped out, leaving farmland to waste. Trade came to a standstill, and economies collapsed. But beyond the death toll, the Black Death fundamentally altered Europe's social structure. Labor became scarce, which meant that surviving peasants could demand better wages, and the feudal system began to break down. The plague also led to a widespread loss of faith in the church, as people sought explanations for the divine wrath they believed was being visited upon them. Some historians even credit the Black Death as a key factor leading to the Renaissance, as the massive societal upheaval created room for new ideas to flourish. Number 2. The Spanish flu. The 1918 Spanish flu was unlike any influenza outbreak the world had ever seen. Infecting 1/3 of the global population, it killed an estimated 50 million people, more than those who died in World War I. What made this flu particularly terrifying was its rapid spread and the fact that it disproportionately affected young, healthy adults, a demographic usually spared by seasonal flu. The Spanish flu came in several waves, with the second wave being the deadliest. It spread quickly due to the movement of troops returning home from World War I, and it was often fatal within hours or days of symptoms appearing. In cities like Philadelphia and New York, hospitals were overwhelmed, and makeshift morgues had to be set up. Public gatherings were banned, and quarantine measures were put in place, but the lack of a coordinated global response allowed the virus to sweep through countries unhindered. The Spanish flu also had long-lasting effects on public health systems around the world. It highlighted the need for better global coordination in the face of pandemics, and some of the earliest influenza vaccines and public health infrastructure can trace their origins back to lessons learned during this pandemic. Number 3. HIV/AIDS. Since the discovery of HIV/AIDS in the early 1980s, this virus has taken the lives of more than 36 million people worldwide. Initially labeled as a gay disease, the stigma surrounding HIV/AIDS delayed research and treatment, leading to a devastating global spread. The virus attacks the immune system, making it nearly impossible for the body to fight off infections, which is what ultimately leads to the disease's deadly nature. HIV/AIDS has had an especially devastating impact on sub-Saharan Africa, where millions continue to live with the virus today. The disease has orphaned countless children and left families and economies in ruin. In the West, the epidemic initially sparked fear and discrimination, but it also led to one of the most significant public health campaigns in modern history. Activists fought for the rights of those living with HIV/AIDS, leading to more funding for research and the eventual development of antiretroviral therapy. These drugs have turned what was once a death sentence into a manageable condition for millions, but a cure remains elusive. Despite progress, HIV/AIDS continues to be a major global health issue, particularly in developing nations. Access to life-saving drugs is still limited in many parts of the world, and the virus remains a leading cause of death in some regions. The fight against HIV/AIDS has been a lesson in how public health, stigma, and global inequality intersect. Coming in at number 4, smallpox. Smallpox has been responsible for some of the most significant death tolls in human history, with outbreaks killing up to 30% of those infected. The disease is thought to have existed for thousands of years, with references to smallpox-like illnesses found in ancient Egyptian and Indian texts. In Europe, smallpox was an endemic disease, but it became a global killer during the Age of Exploration. As Europeans arrived in the Americas, they brought with them diseases that indigenous populations had never been exposed to, smallpox chief among them. The result was devastating. In some parts of the Americas, smallpox wiped out up to 90% of the native population, aiding European colonization efforts by decimating resistance. Smallpox is also responsible for the first known vaccine, developed by Edward Jenner in 1796, after he noticed that milkmaids who had contracted cowpox seemed immune to the disease. The development of the smallpox vaccine was one of the greatest triumphs in medical history, leading to the eventual eradication of the disease in 1980. Smallpox remains the only human disease to be completely eradicated, but its legacy lives on, both as a reminder of the power of vaccination and the devastation that unchecked diseases can cause. Number 5. Malaria. Malaria has haunted humanity for millennia. Caused by parasites transmitted through mosquito bites, malaria is responsible for more deaths than almost any other disease in history. Ancient civilizations, including those of Greece and Rome, recorded the disease, and it continues to be a major killer today, particularly in tropical regions. Malaria played a significant role in shaping colonialism, particularly in Africa and Asia, where European powers struggled to maintain control over their colonies due to the prevalence of the disease. Quinine, derived from the bark of the cinchona tree, was one of the first effective treatments, allowing Europeans to begin colonizing malaria-prone regions, but the disease still proved to be a formidable foe. During the construction of the Panama Canal, malaria, along with yellow fever, killed thousands of workers and nearly halted the project. Today, malaria continues to claim hundreds of thousands of lives each year, primarily in sub-Saharan Africa. Efforts to combat the disease have led to the development of insecticide-treated bed nets, anti-malarial drugs, and most recently, the first malaria vaccine. However, the fight to eliminate malaria is far from over, as drug-resistant strains of the parasite continue to emerge. Coming in at number 6, cholera, caused by the bacteria Vibrio cholerae. Cholera has been responsible for 7 pandemics since the early 19th century. The disease is spread through contaminated water and food, and it can kill within hours if left untreated. Cholera is known for causing severe diarrhea and dehydration, which can lead to death if medical intervention is not provided quickly. The third cholera pandemic, which occurred between 1846 and 1860, was the deadliest, killing over 1 million people. It was during this pandemic that physician John Snow made his famous discovery that cholera was spread through contaminated water, a revelation that laid the groundwork for modern epidemiology and public health. Cholera had a profound impact on urban development, particularly in Europe and North America. In response to outbreaks, cities began to invest in clean water supplies and sewage systems, leading to the modern sanitation practices we take for granted today. Despite this, cholera remains a threat in parts of the world, where clean water and proper sanitation are lacking, such as in areas affected by war or natural disasters. Number 7. Tuberculosis. Tuberculosis, or TB, has been a major killer throughout human history. In the 19th and early 20th centuries, TB was responsible for millions of deaths, and it was especially prevalent in overcrowded urban areas. The disease, caused by the bacterium Mycobacterium tuberculosis, affects the lungs and can be spread through the air when an infected person coughs or sneezes. Before the development of antibiotics, there was little that could be done to treat TB. Patients were often sent to sanatoriums, where they would be isolated from society in the hope that fresh air and rest would cure them. Despite these efforts, TB continued to claim lives at an alarming rate, earning it the nickname the White Plague. The discovery of antibiotics in the mid-20th century, particularly streptomycin, revolutionized the treatment of TB. However, the disease has not been eradicated, and drug-resistant strains have emerged in recent years, posing a new challenge for public health. Today, TB is most prevalent in developing countries, where access to healthcare is limited, but it remains a global health threat. Number 8. Yellow fever. Yellow fever is a viral disease transmitted by mosquitoes, primarily in tropical regions of Africa and South America. In the 18th and 19th centuries, yellow fever was one of the most feared diseases in the Americas, responsible for numerous outbreaks that killed tens of thousands. The disease causes fever, chills, and in severe cases, jaundice, which gives the disease its name, internal bleeding, and organ failure. Yellow fever outbreaks had a significant impact on the development of cities in the Americas. In 1793, an outbreak in Philadelphia, then the capital of the United States, killed around 10% of the city's population and led to a mass exodus. In the early 20th century, yellow fever devastated workers building the Panama Canal, halting construction until mosquito control measures were put in place. The development of a yellow fever vaccine in the 1930s dramatically reduced the number of cases, but the disease has not been eradicated. Today, yellow fever remains a threat in parts of Africa and South America, where vaccination campaigns are ongoing to prevent further outbreaks. Number 9. Plague of Justinian. The Plague of Justinian, which struck the Byzantine Empire in the 6th century, is one of the earliest recorded pandemics in history. It is estimated that the plague killed between 25 and 50 million people, which was up to half the world's population at the time. Like the Black Death, the Plague of Justinian was caused by the Yersinia pestis bacterium, and it spread through trade routes that connected the Byzantine Empire with other parts of the world. The plague's impact on the Byzantine Empire was profound. It weakened the empire at a critical time, preventing Emperor Justinian from reuniting the eastern and western halves of the Roman Empire. The economic and military toll of the plague left the empire vulnerable to attacks from its enemies, and it is considered one of the factors that led to the eventual decline of the Byzantine Empire. While the Plague of Justinian is often overshadowed by later pandemics, it remains one of the deadliest in history, and its legacy can still be seen in the way it shaped the course of European and Middle Eastern history. And finally, coming in at number 10, COVID-19. The COVID-19 pandemic caused by the SARS-CoV-2 virus is the most recent addition to the list of deadly diseases that have shaped history. Since its emergence in late 2019, COVID-19 has infected hundreds of millions of people worldwide and resulted in millions of deaths. The virus spreads through respiratory droplets, and its ability to transmit even from asymptomatic carriers made it particularly difficult to control. The pandemic brought the world to a standstill, with lockdowns, travel restrictions, and overwhelmed healthcare systems becoming the norm. Economies were devastated, and millions lost their jobs as businesses closed or scaled back operations. The development of vaccines at an unprecedented speed helped curb the spread of the virus, but its full impact on global society is still being felt. COVID-19 has also highlighted disparities in healthcare access and vaccine distribution, particularly in developing nations. The pandemic has reshaped how we think about public health, global cooperation, and the role of science in society. As we continue to navigate the post-pandemic world, the lessons learned from COVID-19 will be crucial in preparing for future global health crises. As we've explored, these 10 diseases didn't just claim millions of lives, they shaped the world we live in today. From altering the course of empires to influencing the development of modern medicine, their impacts are still felt. Understanding the history of these deadly diseases gives us valuable insight into how to prepare for future challenges, and it reminds us of the power of scientific advancement and global cooperation in combating the threats we face. Which disease on this list did you find the most fascinating? Comment below to let us know.